Hello, everyone. My name is LynnMarie Jarratt, and I'm with the University of New Mexico School of Medicine. I'm here to talk to you about my project, the creation of a comprehensive COVID-19 daily news and medical literature briefing to inform healthcare and public policy in New Mexico. So how do you stop a never-before-seen deadly virus from wreaking havoc across the globe? Well, we fought back with data. On March 11, 2020, the New Mexico governor declared a public health emergency. As publications regarding the virus increased in number, the New Mexico Medical Advisory Team contacted faculty at the University of New Mexico to form a team to consolidate this information and aid in New Mexico's pandemic management. Faculty, physicians, staff, graduate students, and medical students came together to create the UNM Global Health COVID-19 Intelligence Briefing. With the growing number of daily scientific publications and news reports, and the high risk of community misinformation, we formed a team to consolidate and disseminate relevant daily briefings to inform healthcare and public policy in the state of New Mexico. Microsoft Teams was used for submission and assessment of an average of 456 articles every single day. Articles were summarized with relevant findings and statistics. Multi-level triaging allowed for the most impactful articles to be reviewed and summarized, with priority placed on randomized controlled trials, meta-analyses, reviews, and practice guidelines that clinicians needed. Other topics informing healthcare and public policy in response to COVID were also included. Team members met virtually to edit the briefing for clarity, grammar, and discuss poorly supported studies. The finalized briefing was emailed to a listserv and posted on UNM's digital repository site. An IRB-approved survey to assess the impact of our briefing was sent to our readers. The briefings reached about 1,000 people by email alone, with most forwarding the briefings to colleagues and friends. Tracking showed many thousands of downloads across 116 different countries during our briefing's dissemination from April to July of this year. The survey itself reached over 100 different respondents, 95% of which said they gained new and relevant knowledge about the pandemic. 79% believed our briefing successfully combated misinformation, and 24% used the briefing as their primary source of information. Our briefings informed the governor's cabinet on a daily basis and helped institute early statewide mask policies, altered medication regimens, and practice guidelines relatively early in the pandemic, saving lives. This was an incredibly successful project, as government officials and physicians across the state utilized our briefing. While the goal was to aid New Mexico in the navigation of the pandemic, the briefing reached further than we could have imagined. This project brought together a small community with a global impact. Thank you.